Fibromyalgia, a chronic condition of the central nervous system, is characterized by widespread pain, fatigue, and cognitive difficulties. It is often misunderstood and shrouded in myths. Everyone who has fibromyalgia experiences it differently, which is part of the reason why misunderstandings and myths surround this condition. If you or someone you know is living with this invisible illness, you've likely encountered numerous misconceptions and a lot of misinformation. In this video, we're going to debunk the top 10 myths about fibromyalgia, bringing you the truth straight from the experts. You might be surprised to learn that some of the things that you thought were facts about this condition are nothing more than urban legends. From the myth that it's all in your head to the belief that it's just a fancy term for being lazy, we're going to separate fact from fiction. What's more, the number one myth on our list may be an unexpected one. A common misconception that could be preventing those with fibromyalgia from getting the care they need. By the end of this video, you'll have valuable knowledge to better understand this condition and be an advocate for those affected by it. Let's get started, counting down from number 10. Myth number 10. Fibromyalgia is just a catch-all term or a fallback diagnosis. Many people are under the impression that fibromyalgia is a catch-all or fallback diagnosis because there isn't any single test used to diagnose it. Another reason for the confusion is that fibromyalgia is hard to diagnose. Fact: the truth is, fibromyalgia is a legitimate and complex medical condition that is recognized by major health organizations from around the world and supported by scientific research. Despite these misconceptions, it has specific diagnostic criteria established by the American College of Rheumatology. Research shows abnormalities in pain processing in the brain and spinal cord of fibromyalgia patients, providing a biological basis for the condition. It is important to treat fibromyalgia with the same seriousness and empathy as any other medical condition, ensuring that patients receive proper care and support to manage their symptoms and improve their quality of life. Dismissing it as anything less undermines patient struggles and can hinder access to necessary treatment. Myth number 9. Only middle-aged women get fibromyalgia. Fact: fibromyalgia can affect people of all ages and genders, including children and adolescents. While it predominantly affects women, men can also develop fibromyalgia, though it is often underdiagnosed or misdiagnosed in males due to lack of awareness and gender biases. Men may also be inclined to dismiss symptoms or be reluctant to report them. Children and teenagers may also be diagnosed with fibromyalgia. Juvenile primary fibromyalgia syndrome, JPFS, affects children and adolescents, particularly adolescent girls, and is characterized by the same symptoms as fibromyalgia in adults. Early intervention is important for improving outcomes, as some patients may experience persistent symptoms into adulthood. Increasing education about fibromyalgia, especially its occurrence in men and children, is essential for proper diagnosis and treatment. Myth number 8. Fibromyalgia is just a form of arthritis. Fibromyalgia and arthritis are often mistakenly thought to be the same condition due to their shared symptoms of pain and fatigue. However, they are fundamentally different in terms of their causes and effects on the body. Fact: arthritis is a condition of the joints causing inflammation, swelling, stiffness, and damage over time. In contrast, fibromyalgia is a condition that impacts how the brain and spinal cord process pain signals. It doesn't cause inflammation or damage to the joints, muscles, or other tissues. Fibromyalgia is a disorder of the nervous system and is now thought to be more of a neurological syndrome, while arthritis is a joint disease characterized by inflammation. The pain patterns, triggering factors, diagnostic tests, and treatment approaches are very different for the two conditions. Myth number 7. Fibromyalgia is just about pain. Fact: fibromyalgia is often misunderstood as merely a condition of pain and stress, but it is a complex and serious medical condition with a wide range of symptoms that significantly impact patients' lives. Beyond pain, symptoms include fatigue, sleep disturbances, cognitive difficulties, and mood disorders. Many people with fibromyalgia also experience headaches, irritable bowel syndrome, painful menstrual periods, numbness or tingling in extremities, and sensitivity to temperature, noise, or light. The impact of these symptoms on daily life is substantial. They can interfere with the ability to work, maintain relationships, and perform everyday tasks, leading to a decreased quality of life. The unpredictability and variability of symptoms can make planning and participating in activities difficult. Fibromyalgia involves a complex interplay of neurological, psychological, and physical factors requiring comprehensive management to improve patients' well-being. It is essential to recognize the multifaceted nature of fibromyalgia to ensure appropriate treatment and support. Myth number 6. Fibromyalgia is a rare condition. Fact. Fibromyalgia is often mistakenly believed to be a rare condition due to its diverse and often elusive symptoms. It can be misdiagnosed or underdiagnosed, but it is in fact quite common. Fibromyalgia actually affects a substantial portion of the population, both in the United States and globally. In the United States alone, approximately 4 million adults are affected, representing about 2% of the adult population. Globally, fibromyalgia affects between 2 and 4% of the general population, highlighting its prevalence rather than rarity. In reality, fibromyalgia affects a wide range of ages and both sexes. Myth number 5. You're just depressed, stressed, lazy, a hypochondriac, looking for attention, or it's all in your head. Fact. Fibromyalgia is often misunderstood, but substantial scientific evidence dispels this myth and demonstrates that fibromyalgia is a complex, multifaceted disorder with significant physiological components. Research, including brain imaging studies, has shown that fibromyalgia involves abnormal pain processing in the nervous system, making people more sensitive to pain. People with fibromyalgia have been found to process pain signals differently, indicating a neurological basis for the condition, rather than it being purely psychological or stress-related. There are also imbalances in certain hormones and neurotransmitters, like serotonin and cortisol, which are involved in stress and pain responses. It is diagnosed based on specific criteria and recognized by the medical community as a real disorder with physiological changes. Dismissing it as hypochondria or attention-seeking behavior overlooks the complex and genuine physiological changes that underlie the condition. These myths can lead to stigma and misunderstanding, which may prevent individuals from seeking the treatment they need. Myth number 4. Exercise makes it worse. Fact. When dealing with fibromyalgia, it may seem counterintuitive to keep moving, but maintaining physical activity is critical to help manage the condition effectively. The key to optimal pain relief for people with fibromyalgia is being consistent with physical activity. While it may be challenging at times, there are several reasons why it's important to stay active despite the discomfort. First, engaging in low-impact physical activity can help alleviate muscle stiffness and reduce pain levels by increasing oxygen flow to the muscles. When we are physically active, the brain releases endorphins and serotonin, natural pain-relieving and mood-enhancing chemicals which can help reduce symptoms of anxiety and depression. The release of these chemicals also helps to provide a sense of well-being and lessens the pain associated with fibromyalgia. Regular exercise also plays a pivotal role in combating fatigue, boosting energy levels, and improving sleep quality. By recalibrating the nervous system, regular physical activity can reduce the heightened sensitivity to pain that individuals with fibromyalgia experience. When getting started, it is important to listen to your body. Start with low-impact activities and gradually increase the intensity and duration over time. As always, consult with a healthcare professional or physical therapist who specializes in working with fibromyalgia patients to develop an individualized fitness plan that suits your needs and limitations. Myth number 3. Fibromyalgia is an autoimmune disorder. Fact. When you have an autoimmune disorder, your immune system mistakenly attacks your healthy cells. There are more than 80 conditions labeled as autoimmune. Fibromyalgia isn't on the list. Here's why. Around the turn of the 20th century, experts were trying to better understand fibromyalgia, then called fibrositis. They placed it in the same category as rheumatoid arthritis and labeled it as autoimmune. Doctors later discovered that about 1 in 4 people with fibromyalgia also has an autoimmune disorder, which kept them lumped together. Unlike autoimmune disorders, which involve the immune system attacking the body's own tissues, fibromyalgia does not show evidence of inflammation in the classic sense or tissue damage. The current scientific consensus classifies fibromyalgia as a disorder of pain processing rather than an autoimmune disease. This distinction is important for treatment approaches, as therapies typically used for autoimmune disorders are not effective for fibromyalgia. Although fibromyalgia can occur along with an autoimmune disorder, it is not considered to be one. Interestingly, new research has revealed that fibromyalgia involves inflammation of the immune cells in the brain and central nervous system. These tiny immune cells, known as microglia, become overactive, triggering a state of chronic neuroinflammation. Based on this new research, it is possible that one day fibromyalgia may be classified as an entirely new type of autoimmune disorder, but more research is still needed. Researchers continue to study what links the two together, but at this point they remain separate and distinct conditions. Myth number 2. Fibromyalgia isn't real. Fact. Fibromyalgia is a legitimate and well-recognized disorder that affects millions of people worldwide. Characterized by chronic widespread pain, fatigue, sleep disturbances, and cognitive difficulties, fibromyalgia is acknowledged by major medical organizations such as the American College of Rheumatology. Brain imaging studies have revealed neurological differences in fibromyalgia patients, supporting the theory that the condition involves abnormal pain processing in the brain and central nervous system. This evidence firmly establishes fibromyalgia as a real disorder with a neurological basis, dispelling outdated myths that it is not real or just in one's head. While there is no single test to diagnose fibromyalgia, doctors now have guidelines to identify and treat it. The condition significantly impacts patients' quality of life, with symptoms that can be severely debilitating. While skepticism has existed due to the complex nature of the symptoms and historical misunderstandings, the consensus among medical professionals today is clear. Fibromyalgia is a real, disabling condition that requires proper medical management and support. Myth number 1. There's no cure, so nothing can help. Fact. It's important to understand while there is no one-size-fits-all cure for fibromyalgia, it can be effectively managed through various treatments and lifestyle modifications. Many people with chronic illness lead fulfilling and happy lives by adopting appropriate management strategies. It's also important to keep in mind that there are many diseases with no known cures that can be effectively managed. Conditions such as type 2 diabetes, hypertension, and even HIV are diseases that lack cures but can be controlled through medication, lifestyle changes, and regular monitoring. If you take nothing else from this video, remember this. Lifestyle changes and self-care are critical to improving quality of life for those with fibromyalgia. A comprehensive treatment plan, tailored to the individual, can significantly improve quality of life. Dismissing the condition as untreatable is not only inaccurate, but can also prevent patients from accessing the support and care they need. Successful management often includes establishing good sleep habits, stress reduction techniques, engaging in regular physical activity, and pacing daily activities to manage energy levels. I have videos on all of these strategies on this channel as well, so please check those out. The goal is to decrease widespread pain, improve sleep quality, increase energy levels, and enhance overall well-being. Learning about the science of fibromyalgia can also help to dampen an overly sensitive nervous system. Brain retraining techniques, such as pain reprocessing therapy and programs like the Curable app, have shown promising results in treating fibromyalgia. To try the Curable app free for 6 weeks, click the link in the description below. Brain retraining involves exercises and techniques designed to calm the overactive brain regions responsible for the fight or flight response. The goal is to reduce the body's chronic stress response and restore balance to the nervous system. These approaches help patients by effectively retraining the brain's pain processing system. Studies have shown significant improvements in fibromyalgia symptoms using these methods. Other effective treatments may include medications, cognitive behavioral therapy, alternative therapies like acupuncture, massage, and neurofeedback. It's important to note that treatment effectiveness can vary between individuals. Patients may need to work closely with their healthcare providers to find the most effective combination of treatments for their specific symptoms. Dispelling myths about fibromyalgia is critical for improving awareness and support for those affected. Recognizing fibromyalgia as a genuine, complex condition deserving of serious medical attention is essential. By challenging these misconceptions, we can reduce stigma, encourage proper treatment-seeking behavior, and ensure patients receive the care and support they need to manage their symptoms effectively. The medical community agrees. Fibromyalgia is a real, disabling condition that requires appropriate management and empathy. By fostering understanding, we can significantly improve the quality of life for those living with fibromyalgia. Thanks for watching. If you enjoyed this video, please leave a thumbs up and share with anyone that you think would benefit from this information. Doing so will really help to support the channel and allow me to continue making these videos. And don't forget to subscribe so that you don't miss out on future videos.